This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Krystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. We're with you again to talk about the latest news concerning COVID-19, what you need to know to stay healthy, keep your family healthy, and the vaccine, which is on the horizon. In fact, it has arrived for some healthcare workers, and it's going to arrive for Monongalia County school employees, hopefully later this month, and then for the rest of us sometime very, very soon. But we appreciate you joining us this morning. Dr. Krystal Atkinson is back with us, and Dr. Atkinson, thanks for joining us.
Thank you so much for having me, Cal.
Also, we've got with us Dr. Shane Prettyman. Dr. Prettyman with the Mon Health Systems, OBGYN, and co-director of Women's Services at Mon Health Medical Center. And Dr. Prettyman, thanks for coming on this Saturday morning.
Good. Glad to be here.
All right, let's start with the basics. Of course, we're doing this show every Saturday morning to try and get information out, what people need to know about the latest with this pandemic, COVID-19. The cases are up. We all know that. We follow the news. So, Krystal, let's start with you. Give us an update on the current surge and, again, what people need to know, what they need to do to keep themselves healthy.
Yes, absolutely, Kyle. We are continuing to see, not just in our county, but across the state, we're continuing to see the numbers of COVID cases rise, and a lot of those cases are now translating to hospitalizations. So, again, as we talked last week, we really need to focus on the basics. I can't say it enough how important the masks are. First level of defense to be able to keep us protected and to keep those around us protected, in addition to social distancing. We need to make sure that we're washing our hands, and then we need to make sure that we're doing good self-care. We need to make sure that we're getting the appropriate rest and making sure that we're eating properly. But again, as we stressed again last week, the mask is our first level of defense.
Mm-hmm. Dr. Prettyman, we're going to talk a little bit more coming up about what this means for women who are pregnant, and obviously that's always a tenuous time, but especially with this virus going around. We'll get into that in a little bit, but Dr. Prettyman, do you have anything to add about the basics there, how people need to protect themselves?
Yeah, no, I think that the population really needs to just focus on, getting their information from medical sources, from scientists, from the experts. Don't get it from friends. Don't get it from family. Don't get it from coworkers who may have biased views. I think, there's so much misinformation out there. Politics gets rolled into this. And, the medical community and the scientists specifically, they have a structured regimen on how they do their studies, on how they come up with vaccines and the safety. And that's what they do. That's what they report. And that's the information we should pay attention to when we're deciding how should we keep ourselves safe, masks or not, groups or not. Should I get together with family over Christmas or not? Who should we get together with? Should we get the vaccine or not? You've got to pay attention to the experts and kind of ignore all the other noise out there.
Okay, well, let's expound on that a little bit, and we'll talk about the vaccine in a moment. But what about small groups? What about groupings of any size coming up? Obviously, we're in December, Christmas about a week away or so. What would be your advice about family gatherings of any sort here for the Christmas and New Year's holidays?
Sure, Krystal, I'll start if you want to kind of follow up. The CDC is crystal clear on this. If you look at what they say that you need to stay within your single-family household. When you start mixing it up with people from outside, and that includes grandma and grandpa, right? You increase people outside of your typical circle, and you expose yourself for risk. And I know we all think that I'm not going to get it, I'll be okay. But that's not the case. And we've seen these small groupings. We saw it at Thanksgiving. It was the small family groupings were the main source of the rise and the surge that we're getting right now. So when the CDC says stay within your family group, your single family group, that's what they mean, and they say that for a reason. Evidence backing that up. And we've seen, when we don't listen to them, we see what's happening right now. And if we continue to say, I'm special, or it'll be okay, maybe everybody else will follow it, but I don't need to, that's when, we'll have another surge here after Christmas.
Yeah, and with the cold and the weather, it's keeping people inside, and that exasperates things. At least when the weather was good, people were able to go outside and maybe have some gatherings or have some activities outdoors. But Dr. Atkinson, that's just simply not possible for the most part here in December and as we head through the winter.
No, absolutely. And I think that, as Dr. Prettyman shared, we have to also think about, while we may not feel bad, as much as we love our extended family, we have to think about those who may have comorbidities, those who are a bit older, and that we could be an asymptomatic carrier and we could spread the virus to them. So really, when we think about it, this is a time that if there's ever a time to have this happen, the time now where we have so much technology, we need to utilize that. Whether it's Zoom, whether it's FaceTime, etc., we need to make sure that we're having virtual visits.
Okay, Dr. Atkinson, I understand there's some visitation changes. I'm assuming that's for the hospital to try and ensure safety for staff and for people who enter the facility. You want to go over some of those visitation policies?
Yes, absolutely. We really haven't changed a whole lot to our visitation policy, with the exception of we decreased our hours from 8 a.m. to 7 p.m. to 12 p.m. to 7 p.m. We are still focusing on having that one consistent visitor that comes in with our patient. Of course, there's always exceptions. If we have people that have special needs and they need to have somebody with them during a visit, coming to the ED or for testing, of course we'll make those exceptions. But all of our information, very specific for all of our units, can be found on monhealth.com/coronavirus.
Okay, what about what about procedures? If someone is scheduled for a same-day procedure or an outpatient procedure, what's the policy there in terms of them being accompanied into the hospital?
Yes, the same policy is in effect. If they need an individual to accompany them, they're more than welcome to be able to bring them. Again, we're trying to err on the side of caution for everyone, and if that's not needed, we appreciate just having the patient in the facility.
All right, let's talk about the vaccine. The vaccine fast-tracked. We've seen instances of the Pfizer vaccine that have already reached West Virginia. There's word that the Moderna vaccine will be approved very soon, and we could see inoculations with that vaccine here very, very shortly. What's the status, first of all, I ask both of you doctors, what's the status of the healthcare workers in the Mon Health system in terms of the vaccine?
So we've received our vaccine, and we started our vaccinations yesterday morning. It's really exciting to be able to see the enthusiasm from our team as they're coming forward and they're being leaders in this effort to get the vaccinations. So again, we're making sure that folks at the front line, they are receiving the vaccines first, and then we will follow the guidance as it comes out on how to be able to get the vaccines for everyone else who would like to have them. The shipments are coming in 3 weeks, 3-week period. So we've had our first week, then we'll have some more come in the second week, next week, and then the following week. And then there's 2 doses that are given, 28 days apart right now.
Mm-hmm. Dr. Prettyman, anything to add on that?
No, I think, again, exciting that the vaccine is here. A lot of healthcare employees are doing that. Again, I think, I've talked to some health care employees, and they're a little bit hesitant to get the vaccine. But when you really try to engage in a conversation with them, it's usually not based on research. It's usually just I've heard everything from I polled my friends on Facebook and they aren't getting it, or they may not be. Versus there's another nurse who's influential and outspoken, and she's, an anti-vaxxer, and, therefore, I respect her because she's a great nurse, and I'm also going to do what she says from the vaccine. So I think there's, again, misinformation, which is, again, why we would, pull up CDC, Google CDC, safety, CDC vaccine. It takes 1 second to get there and have, evidence-based stuff, proving the safety of these vaccines and the efficacy of the vaccines.
Okay. Have either of you had the first round of vaccinations?
No, I'm not in that
Not yet.
group yet, but I
think I'm
am
coming up. I think
enthusiastically waiting.
In the next few weeks, I think, anesthesia, the ER, the ICU, the COVID units, they're the first up to get it. I think the OBGYN unit, the obstetric unit, is shortly thereafter, so I should be coming up within the next few weeks or so. And I'm excited to get my vaccine.
All right, very good. We need to take a break. We're halfway through this Saturday morning, Mon Health Live, and we'll continue the conversation with our guests about the latest on COVID-19. Stay with us. We'll be back after this on WAJR.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Krystal Atkinson.
David Goldberg not with us today. We anticipate him returning next week to Mon Health Live, but we are joined by Dr. Krystal Atkinson and also Dr. Shane Prettyman. He's with Mon Health OB/GYN, co-director of the Women's Services at Mon Health Medical Center. And Dr. Prettyman, one of the issues we wanted to focus on today's edition of Mon Health Live is pregnancy and COVID. So let's get into that a little bit. First of all, if you're a pregnant woman, are you more at risk of getting COVID-19, and is it more dangerous to you and to your child if you do contract the virus?
So the answer to that question is yes. When you're pregnant, your immune system is suppressed, and you're more susceptible to the common cold, to influenza, and therefore to coronavirus. Studies have shown that pregnant women are more likely to become infected with coronavirus, and if they are, they're more likely to have severe disease, more likely to be in the ICU, more likely to need a ventilator, and more likely to pass away. While the individual incidence of those severe complications are still, yes, uncommon, it is more likely for that to happen to a pregnant woman than to a non-pregnant woman.
Mm-hmm. All right, so if you are pregnant and you think you have COVID, what should you do?
Yeah, call. Please call, please call, please call. So call our office, call the on-call physician, call the hospital, call the emergency room. So I think call first so that we can direct you and tell you what to do. Oftentimes, if we need to evaluate you, we're going to try to figure out, are you symptomatic? Where should you come to? Should it be to the office? Should it be to the emergency room? Should it be just to a testing site to see if you do? And we want to be prepared for when you come so that, our providers can, have their appropriate PPE, and we can, prevent that patient coming in from potentially exposing others. So I think call. And it really kind of depends on the situation with the individual, which is why you should call, and each individual is different. If you've been exposed to somebody, no mask, if you've been within 6 feet for more than 15 minutes apart, and that's a significant exposure, then you should be tested. Testing is the number one thing that we can do to get data to find out if you have it or not. About 50% of people, who are exposed, or I should say 50% of people who would test positive are asymptomatic. So don't go just based on your symptoms. So if you're exposed to somebody, yes, you should be tested. And then we would just kind of break down. We have algorithms to look at, if you're asymptomatic, yes, you should be tested, but do you need to seek care? Do you need to come to the office? Do you need to come to the emergency room? And oftentimes, if you don't have severe symptoms and you don't have any other comorbidities, we want to find out if you're positive, but we can just manage you at home and continue caring for you, whether it's telehealth visits, phone calls. But a lot of times you don't need to come in unless you do have other comorbidities that we need to evaluate the severity of your symptoms, or if it sounds like you are having severe symptoms and need to be hospitalized, then we would direct you to the correct place to go.
Okay, what are the dangers that this virus presents to an unborn child?
Well, so far, we haven't had a lot of dangers, let's say, to an unborn child. It's more of, or transmission during pregnancy to an unborn child. It's more of, what could it do to a pregnant woman? And, preterm labor is the main thing that comes up. Anytime you have an infectious issue, whether it's influenza or coronavirus, you are more likely to have a preterm labor. And then, the same thing with the pregnant and non-pregnant patient. You think lungs first. So respiratory compromise is the big issue with coronavirus. Pregnant women, their lung physiology is different than non-pregnant women. So, again, more susceptible to having, respiratory issues. So if that's the case, if you're not oxygenating yourself well, you may not be oxygenating the baby well. So we would just need to enhance that, more oxygen and evaluate the baby and make sure the baby is doing well.
Mm-hmm. All right. What about the vaccine? If you are pregnant or if you've recently had a child and you're nursing, what about the vaccine? What's your advice to the women in those two categories?
Sure. So the studies did not purposely include and study pregnant women and lactating women. Those studies are ongoing right now, and I think we will have some results here as the months progress, but it didn't purposely do that. So for that reason, a lot of the concern was it wasn't studied, we don't have safety data, therefore you should not do it. That was the initial thought. Now, and honestly, this stuff changes, which is why I'm glad we're doing this show weekly, and patients should continue each time they're at the doctor, ask what is new. Just this past week, the American College of OB/GYN, I have it pulled up here on my computer, and I'll read it. It says, the COVID vaccine should be offered to lactating individuals similar to non-lactating individuals when they meet criteria for receipt of the vaccine based on their prioritization group. So breastfeeding women absolutely should get the coronavirus vaccine when their group is up. So if you're, one of the frontline workers, that means now, and if you're breastfeeding now, yes, you should get the coronavirus vaccine. So when your group comes up, yes, you should get the coronavirus vaccine if you're breastfeeding.
Mm-hmm. All right. Sorry, go ahead.
From a pregnancy standpoint, it's not quite as clear. It says, and again, that the vaccine should not be withheld from pregnant individuals who meet their priority groups. So it should not be withheld. And it says to have a conversation with your provider. I know from the OB/GYNs at Mon General that I've talked to, I know from one of the high-risk maternal fetal medicine obstetrical providers at WVU who's pregnant, who's planning to get the vaccine. Most doctors are recommending if you have a significant exposure, so if you're a healthcare employee, and with the surge going on right now, most of the doctors are recommending pregnant women to get the vaccine. But that depends on the patient's comfort level. Some patients are going to be more leery. Some are going to be wanting to get it. It just kind of depends on the patient. That's where you really need to talk to your provider about it.
Okay. What about basic gynecologic care? Have you seen a trend with women being reluctant to come to the facility, or what's your advice to someone who's, who needs routine care?
Yeah, so I think, there's always some patients that are more reluctant than others. I think we've all, to a certain degree, gotten used to living with this, maybe to our detriment. But I think, earlier this spring, yes, all essential, non-essential appointments, and that included a lot of GYN care, we cut out. We're back to doing it right now. So our office is open. We're not eliminating anybody to come, assuming that they're not sick. If you have had a recent case of coronavirus and you have non-urgent symptoms such as urinary tract infection issues, no, you should not be coming to the office. Call us. We may be able to treat you over the phone, but you don't need to come to the office for that. But if you are not actively sick and if you have not had a recent exposure, then absolutely we're open to care for you.
All right, great information concerning this virus and pregnant women and women who are breastfeeding. It is the advice that you go ahead and get the vaccine. So this is good information about people. If women are pregnant, there's a little bit of anxiety that comes with that, and then you put the pandemic on top of everything. You can see where there's some issues there.
Absolutely.
All right, we got a couple minutes left in the show, and I want to bring Dr. Atkinson back in. Doctor, of course, we've all heard the same horror stories about more urban locations, where places where the hospitals are overrun and you can't get into the emergency room. But that is not the case right now with Mon Health Systems. You've got capacity in the hospitals.
We have capacity, and as we spoke last week, we want to make sure that, as Dr. Prettyman was saying, call your PCP if there's questions or concerns. If there's a concern about physically coming, we have telehealth visits available. But our EDs are ready to serve. We have safety measures in place to make sure that we have people distanced so everybody can have the appropriate care that they need, but we don't want anyone putting off care. We need them to reach out to PCPs and or come to the ED.
Okay, and if you are considering, if you're looking to come to any of the emergency rooms, there's a way to check the wait times, and it's very simple. Just go to the website, monhealth.com/MH/ER wait times, and all the information's there for the Mon Health Medical Center, for Mon Health Preston Memorial, for Mon Health Stonewall Jackson Hospital, and also for Grafton City Hospital. All that information, I just checked it right before we went on the air. It's really neat. The emergency room wait times come right up, so you know the status of what's going on at the hospital.
Absolutely.
All right, very good. Guys, down to about the final minute here. Anything to add that we haven't covered today?
No, again, just a reminder, we just want to make sure that people are aware of, what's out there. This is, we're still in a pandemic. Please don't get weary. Let's make sure we're social distancing, wearing our mask, and making sure that as we go into the holidays, we're staying safe. Mm-hmm.
And the vaccine for the virus has arrived. So for healthcare workers, and it's going to be a while before we all have access to that vaccine, but it's a light at the end of the tunnel, and it's something that's very, very much welcomed, hopefully, to get us out of this here over the course of the next few months. Guys, again, great information. We appreciate it. Our guests this morning, Dr. Krystal Atkinson and Dr. Shane Prettyman. Again, guys, thanks. We appreciate it.
Thank you so much, Kyle.
All right, that is Mon Health Live, 104.5 FM, 1440 AM, WAJR.